96% of our beds remain available for patients. And as of yesterday, we've delivered over 6.5 million pieces of PPE, which includes masks, gloves, gowns, and ventilators that have been distributed to organizations, healthcare workers, first responders, and others. And we continue to aggressively pursue all supply chain avenues with respect to that. With respect to nursing homes, Massachusetts has unfortunately evolved into a national hotspot for coronavirus. Similar to other states, nursing facilities have been hard hit by this insidious virus that's particularly tough and lethal for older adults. In total, there are 386 nursing homes in Massachusetts, 255 assisted living residents, and 93 rest homes. There are approximately 38,000 residents in nursing homes, 16,500 residents in assisted living facilities, and approximately 3,000 in nursing homes. To date, 10,031 residents and staff working in long-term care facilities have tested positive for COVID-19 in approximately 300 facilities. These facilities represent about 56% of the state's total COVID-19 deaths. The numbers are tough to comprehend, but they illustrate the lethal grip COVID-19 can have on seniors, and especially on those with underlying health here in the Commonwealth. And obviously, our deepest condolences go out to the families, loved ones, and staff who have been impacted by this horrible virus. Our command center has a dedicated team that's focused solely on supporting long-term care facilities. The nursing home industry makes up an entirely privately owned and operated collection of providers. And while they must follow state and federal guidelines, there's a wide range of variance on the way homes operate. Early on, our administration implemented a series of regulations, including strict restrictions with respect to visitors and screening guidelines for staff. The Department of Public Health has been assigning an epidemiologist and nurses to support the staff who are currently working directly with residents when an outbreak occurs. On April 7th, our administration announced the launch of a mobile testing unit for long-term care facilities through the Massachusetts National Guard. This resource significantly expanded testing for residents and staff with minimal disruptions in care delivery and service. To date, the mobile testing unit has conducted testing at more than 400 facilities, including nursing homes, rest homes, and assisted living residences, and they've completed a total of over 18,300 tests for staff and residents at those locations. The Guard's done a tremendous job so far and will continue this work to reach as many facilities as possible so that we can get the best information about where the virus is present. As needed, the state has stepped in to assist nursing facilities to respond to the pandemic. This includes the aforementioned expanded mobile testing, robust PPE distribution, crisis management support, rapid response clinical teams, and the activation of a nursing home family resource line. To help address staffing shortages, we launched the long-term care portal to help facilities match with available staff and funded a signing bonus for those who signed up through this portal to get hired. We also developed a three-pronged approach to expanded capacity for COVID-19 dedicated nursing facilities. Depending on the circumstances, we've also established fully dedicated COVID-19 facilities, opened empty facilities to support COVID-19 residents, and created dedicated COVID-19 wings within facilities. And while that may not seem like a very long time ago since we introduced many of these supports, we've continued to discuss the issues and concerns of the nursing home industry and the long-term care community with our folks at the command center, and have learned a tremendous amount about the current challenges that facilities continue to face when managing COVID-19. And today we're announcing new measures, including an additional $130 million available for nursing homes. This is the second round of $130 million, which comes on top of the $130 million that we announced on April 15th. We're also making additional assistance available to help address staffing shortages as well. The new funding will be made available on May 1st to help pay for more staff, implement state-of-the-art infection control, cleaning services, personal protective equipment, and other support services. These funds will be allocated to nursing homes that are meeting a benchmark for for certain criteria to ensure these privately operated facilities are working as safely as possible. In addition, we're boosting additional assistance for temporary staff support, including clinical response teams of 120 nurses and certified nursing assistants that can be deployed in teams to facilities in emergency situations. On-the-ground crisis management support from experts, and deployment of the National Guard to help with logistical, environmental, and other support. This is in addition to the mobile testing services that we're already providing. These new staffing resources will be available for all nursing homes. Our administrations work closely with the Massachusetts Senior Care Association to create a centralized infection control command center utilizing experts from Hebrew Senior Life and other providers. They will provide direct infection control support to facilities that need help. The Commonwealth's 386 nursing homes come in all shapes and sizes. They offer different levels of care and provide support for their residents in varying stages of health, all the way through to end-of-life care. Nursing homes have a pressing obligation to provide the best care they can for many of our most vulnerable and fragile residents. The introduction of any illness, but especially a virus like this, can be lethal for our elderly and challenging for staff and caretakers. This would be true for the flu or the common cold, but it's been significantly amplified by COVID-19.